It's a very small dose of developmental toxicology. Uh, how the chemicals affect your health as far as reproduction and developmental toxicity is concerned. Here, I'm going to give some agenda of this today's session. That is, we have some brief introduction, history of developmental toxicology, some case studies, what are the regulatory requirements in preclinical studies, and one preclinical study I'm going to explain in teratology is concerned. So, developmental toxicology refers to adverse effects on developing organism that can occur during the pregnancy or early life stages. These effects may be induced by exposure to chemical, physical, or biological agents and can manifest as a structural malformations, growth alterations, functional malformations, or postnatal developmental disorder. This toxicology emphasizes the study of pharmacokinetics, mechanisms, pathogenesis, outcomes following the exposure to agents or conditions leading to the abnormal development. So developmental toxicology mainly includes teratology or study structural birth defects. This is the ancient awareness. Many ancient cultures had fertility goddess. The teratology study of congenital abnormalities and birth defects has a rich history that spans centuries. Ancient civilizations such as Egyptians, Greek, Rome were of congenital abnormalities and often attributed to the structural or divine forces. So many ancient documentations are present regarding the malformation. Malformation is this aspect of the mythology also. In 6500 BC, Turkey figurine of congenital twins also they noted. In Australia, some drawings are present of congenital twins in 4000 and 5000 BC in Australia. 15th and 16th centuries, the malformations caused by the devil mother and child killed. In, this is the brief history I am talking about regarding the developmental toxicology, how it develops from the past thousands of years. The 1830s, the experimental is going on with chicken eggs. In the 19th, some acceptance is happen of malformations related to the genetics. And 1940s, one experiment is going on that environmental factors also affects on the rat development. In 1941, human malformation linked with the rubella virus is also documented. In 1960s, that is we call as wonder drug gone wrong, that is thalidomide, we all know that. That form cause human malformation. In 1950s, mercury also recognized as a developmental toxicant. 1970s, alcohol-related developmental effects, that is called as fecal alcoholic syndrome. So, what are the key aspects of the developmental toxicology? It is the critical windows of susceptibility. Means the developmental toxicity often depends on the timings of the exposure related to the key developmental stages. For example, organogenesis and neurodevelopment. What are the types of effects? Effects means the teratogenicity, that is induction of the structural malformation, heart defects, cave palate, etc. The causes of the developmental toxicity, that is environmental agents, for example, or maternal factors. Environmental agents, the exposure to the pollutants, for example, pesticides, heavy metal, radiation, or certain drug. What is the importance in understanding the developmental toxicity? It is critical for protecting public health, informing regulatory policies, and guiding safe exposure levels for chemicals and drugs. So developmental toxicity studies are conducted in laboratory animals, for example, rat and rabbits, to assess the potential risk of substances to human health. So these studies help identify hazardous agents and inform a risk assessment process. So by studying developmental toxicity, researchers, scientists, and regulators work to mitigate risk and protect vulnerable populations, particularly pregnant individuals and children. So, what are the human birth defects? So, development of highly sensitive tests that can detect pregnancy shortly after fertilization, recognize pregnancy, loss increased to as much as 60 to 70%. Less than half conceptions result in the birth of normal healthy infant. Post-implantation pregnancy loss nearby 31%. 2 to 3% major birth defects at birth. At 1 year, 6 to 7% major birth defects are recognized. 14% will be the minor birth defects. There are about 7% low birth weight. Before 1 year, 1.4 infant mortality and 16 to 7% abnormal neurological function. So these are the schematic diagrams of the causing of human congenital abnormalities. So we don't know the what is going to affect our developmental process. Uh, that is, what effect will be occur. That is unknown etiology is 50 to 50%. Multifactorial, it could be the 20 to 25%. Chromosomal defects 7%. Mutant agents 8%. And environmental agents, that is pesticides and all this 1 to 10%. What are the human development toxicants? That is radiation, some infections, maternal trauma and behavior, and drugs and chemicals. In radiation, for example, atomic folate, radioiodine, therapeutic radiation, these are the responsible for the human development toxicants. So the toxicants interact with the human development. Then rubella virus, herpes simplex virus 1 and 2, this kind of infection also leads to the problems in the human development. Maternal trauma and behavioral function, alcoholism, diabetes, folic acid deficiency, this kind of leads to the maternal trauma or behavioral dysfunction. Drugs and chemicals, that is lead, lithium, mercury, tobacco smoke, and vitamin A. Now we go by one some classical examples of the human toxicity, that is maternal rubella infection. The correct 1941 reported the first recognized case of widespread human malformation. Epidemic of rubella virus infection in Australia, congenital malformations including eye, heart, and ear defects, and mental retardation. Heart and eye defects were associated with the maternal function in the first 2 months of the pregnancy, while hearing loss and speech defects and mental retardation occurs with the third month of the infection. In United States alone, it was estimated 20,000 children were adversely affected. So rubella is now uncommon in the developed countries due to widespread vaccination, but there have been recent outbreaks in developing countries as well. Now we know the thalidomide, which we call as wonder drug gone wrong. Thalidomide was first marketed in the Europe in 1956, and it was used throughout much of the world as a sleep aid and treatment for the morning sickness. In 1960, a striking increase in the newborns with rare limb malformations were recorded in West Germany. So what is the damage? 10 to 12,000 thalidomide babies were affected, including 46 affected countries were observed, drawn out legal battles and disrupted families. Thalidomide presents in a variable patterns of the development toxicity in at least 9 species in which it has been tested. Increased embryonic loss has been observed in some studies in rat. While generally no effect were reported in the studies with most mouse strains. Effects more or less similar to those observed in humans have been reported for the several rabbit strains and in 8 of 9 non-human primate species tested. What are the symptoms? These are the paper-like limbs, hypomelia, missing limbs, some heart abnormalities also, number of digit abnormal, missing and malformed eyes and ears, anal atresia also documented, and brain damage and autism. Now, thalidomide is currently used to treat two main conditions, that is multiple myeloma and lepra reactions, a type of blood cancer that affects plasma cells in the bone marrow. Thalidomide is used in the combination with other medications such as dexamethasone to treat this condition. So, inhibits the tumor directly. The drug will stop blood vessels from forming in the around tumors. It also activates the human system. Anti-inflammatory also it can be used and promising results seen in the most intractable cancer. In complication of leprosy, a chronic bacterial infection that affects the nerves, skin, and mucous membrane. Thalidomide is now used to treat and prevent moderate to severe skin lesions associated with this condition. Thalidomide modules the activity the body's immune system, helping to indirectly attack cancer cells and stop the growth of blood vessels in the cancer. So it also blocks the activity of tumor necrosis, which causes the inflammation of the skin conditions like erythema, neurosome, leprosome. Due to this potential to cause severe birth defects, thalidomide is available only through the special restriction of distribution programs called as thalidomide REMS. So ethanol and alcoholism. So any consumption of alcohol during any time of during gestation period can damage the baby's brain. So fecal alcohol syndrome and fetal alcohol effects are growing problems in the United States. Despite of warning posted in the bars and restaurants and the increased media attention given to the benefits of alcohol use during pregnancy, the rate of drinking among the women of childbearing age continues to rise. The incidence of fecal alcohol syndrome may be high at 12,000 per year, with fecal alcohol observation evidence up to the 36 infants per year. Drinking during the pregnancy affects not only the mother but also growing child. Alcohol can cause physical deformity and neurobehavioral defects in the infants and growing child. Thus, it is not surprising that fecal alcoholic syndrome is the leading cause of mental retardation and only one that be preventable. So parental and or postnatal growth delay, high and low bob, high and or weight below the 10th percentile. These are the effects. Central nervous system involvement, conditions such as head circumferences below the third percentile, intellectual impairment, learning disabilities, attention defects, hyperactivity, or other neurological abnormalities also caused by the consumption of alcoholism during pregnancy. Typical characteristic features: short eyes, slit, mid-face, existing space between the nose and upper lip. These are the classical symptoms of the fecal alcohol syndrome. So these are the schematic diagram that I am going to show you. There is a cell characteristic that suggests the diagnosis of fecal alcohol syndrome. So, low nasal bridge, short nose, thin upper lip, small chin. These are the classical characteristics of the facial characteristics of the fecal alcoholic syndrome. Next one is tobacco smoke. Tobacco smoke is also known to developmental toxicant that can harm the fetal development during pregnancy. Exposure to tobacco smoke has been linked with the various adverse outcomes. Tobacco smoke and its constituents may represent the leading cause of environmentally induced developmental disease and morbidity today. Despite of public health programs aimed at smoking cessation, approximately one quarter of women smokers in the United States continues to smoke during the pregnancy. Adverse consequences of developmental tobacco smoke exposure, including spontaneous abortion, prenatal death, sudden infant death syndrome, that is we call as SIDS, disorder of learning, behavior, and attention, and low birth weight. So, low birth weight babies born to mothers who smoke during pregnancy are more likely to have low birth weight, which can increase the risk of health problems. Preterm birth, that is, smoking during the pregnancy increase the risk of preterm birth, which can lead to the respiratory and other health issues. Birth defects, we can say that tobacco smoke exposure can link to an increased risk of birth defects such as cleft palate and heart defects. Sudden infant death syndrome, that is we call as SIDS. Smoking during pregnancy and exposure to second-hand smoke after birth increase the risk of SIDS. And neurodevelopmental problems. The exposure to tobacco smoke in utero has been linked to the conjunctive and behavioral problems in the children. The mechanism, what is mechanism? To reduce placental flow. The tobacco smoke can reduce blood flow to the placenta, depriving the fetus of oxygen and nutrients. Offspring of the smoking mothers have a higher risk of obesity, hypertension, and type 2 diabetes than the offspring of the non-smoker. The main content of the tobacco is nicotine, is the known as neuroteratogen in experimental animals and can be itself produce many of the adverse developmental effects of the tobacco smoke, including respiratory dysfunction, hypertension, obesity, and type 2 diabetes. It can also increase the oxidative stress. Tobacco smoke contains chemicals that can cause oxidative stress, leading to the damage to the fetal tissue. Tobacco smoke exposure can disrupt normal fetal development, leading to the structural and functional abnormality. So, how can we prevent it? Quit smoking. Quitting smoking during pregnancy can reduce the risk of adverse outcome. Avoid secondhand smoke. Avoiding exposure to secondhand smoke during the pregnancy and after birth can also reduce the risk of adverse outcome. And, and public awareness, health awareness, implementing the public health initiative to reduce tobacco use to exposure and exposure can help protect fetal and child health. Retinoids. Retinoids is derivatives of the vitamin A and are known developmental toxicant that can cause birth defect and developmental abnormality. Excess vitamin A has been known to be teratogenic in rat. So developing structural effects include the face, limbs, heart, central nervous system, and skeleton. Retinoid acid administration to the pregnant mouse or hamster produce the same malformations which are observed in the rat. Effect on development, that is teratogenicity, growth restriction, and neurodevelopmental problems. That is CNA induced potential effects CNA, birth defects, and growth restriction. Retinoids can cause structural malformations such as craniofacial, cardiac, and central nervous system defects. Growth restriction also exposure can lead to the growth restriction and low birth weight. Retinoids can also affect the brain development, leading to the conjunctive and behavioral problems. Now, second one is pesticides. Pesticide can be developmental toxicants, potentially harming fetal development and child health exposure. Child health exposure to the pesticides during pregnancy or early childhood may increase the risk of various adverse outcomes related to the CNS, birth defects, and growth restrictions. All this I am going to show this classical example. The all are mainly on CNS, birth defects, low birth weight, low body weight, low growth restrictions issues. Neurodevelopmental problems, exposure to certain pesticides has been linked to the behavioral and motor skill problems in the children. Birth defects includes some pesticides may increase the risk of birth defects such as heart defects and neural tooth defects. Growth restrictions, pesticides exposure has been associated with reduced fetal growth and low birth weight. What are the common pesticides? These are the organophosphate, pyrethroids, and glyphosate. Organophosphate is a class of insecticides that can affect the brain development and function. Pyrethroids is a class of insecticides that may affect the neurodevelopment and increase the risk of ADHD and autism. And glyphosate, widely used herbicide that has been linked to the potential developmental toxicity. What are the how we can expose to this pesticide, the occupational exposure? So people working with the pesticides, such as farmers or agriculture workers, may be at higher risk of exposure. Environmental exposure, pesticides can contaminate air, water, food, leading to exposure through everyday activities. And home use, pesticide widely used in the homes and gardens can also lead to the exposure. How can we reduce this exposure? So we can use the protective equipment, wear protective PPE such as gloves, masks when the handling pesticides. We can always go for better alternatives, that is integrated pest management strategies, or use safer or more targeted pesticides. And always follow the safety guidelines, label instructions, take precautions to minimize the exposure. So research on the pesticides and developmental toxicity can inform regulatory decisions and help protect public health, particularly for vulnerable population like pregnant women and children. Approximately 80,000 chemicals listed by the EPA. So most of these chemicals have not been tested for the developmental toxicology. For example, high production volume chemicals. So approximately chemicals produce more than 1 billion LPS per year. Approximately 3,000 chemicals identified internationally and few only tested for both reproductive and developmental toxicity. So what are the regulatory requirements? Regulatory requirements for the reproduction and developmental toxicity studies varies depending upon the region and the type of substance being tested. So these are the few guidelines which are used for the reproductive toxicology studies. That is BCGI, Drug Control Government of India, CIB, Central Institute Board, and Developmental biotechnology derived chemicals. Internationally, OECD, US FDA, EPA, ICH, WHO, PPTS, etc. What we are looking for in preclinical studies. What are the adverse effects of the treatment? How the dose-response relationship is occurred? Evidence of the different sensitivity of the reproduction organ system compared to the other system. Safe NOEL, no observed effect adverse level, and differentiation effects in the mother and baby. So I am going to give this one study that is called as prenatal developmental toxicology study, classically called as segment 2 teratology study. This test system uses rat, mouse, and rabbit. Some basic principle of the teratology. The Wilson principle of the teratology are the 6 fundamental principles that guide the understanding of teratology, the study of birth defects and developmental abnormalities. So these principles were outlined by James Wilson in 1959 and remains still in Bible in the field of teratology. First principle is susceptibility to teratogenesis depends on the genotype of the conceptus and the manner in which this interacts with adverse environmental factors. So this principle highlights the importance of genetic factors in determining susceptibility to the teratogenic agents. Second is susceptibility to teratogenesis varies with the developmental stages at the time of exposure to an adverse influence. So this principle emphasizes the critical periods of developmental during which the embryo or fetus is most vulnerable to the teratogenic agents. So teratogenic agents acts in specific ways on developing cells and tissues to initiate the sequence of abnormal development fetuses. So this principle suggests that the teratogenic agents can act through specific mechanism to disrupt the normal development. Fourth one is the access of adverse influence to the development tissues depends on the nature of the influence, that is we call it agent. So this principle highlights the importance of the physical and chemical properties of the teratogenic agents in determining their ability to reach and affect development tissues. So four manifestations of deviant development are death, malformation, growth retardation, and functional defects. So this principle outlines the potential outcomes of teratogenic exposure. And last one is manifestation of deviant development increase in frequency and degree and dosage increase from the no effect to mortality. So this principle emphasizes that the dose response relationship between the teratogenic agent and the severity of developmental abnormality. So Wilson principle of teratology provides a framework for understanding the complex interaction between the genetic and environmental factors that contributes to birth defects and development abnormalities. So these principles have important implication for research, risk assessment, and prevention of birth defects. So this is classical OECD 414 prenatal developmental toxicology study. This is a typical reproduction cycle, sexual maturation to the sexual maturation, the release of gamete, mating, fertilization, transport of zygote, implantation, embryogenesis, phytogenesis, birth, lactation, postnatal development, growth and development, and the segment. So what is the principle of this study? In developmental toxicity test, that is segment 2 ICS test teratology study, the pregnant laboratory species are exposed to the candidate drug to assess the potential for the adverse effect on the development of offspring. These tests assess only prenatal growth, morphological development, and survival, as exposure occurs during the gestation and offspring's evolution in the form of external visceral and curated carried out prior to the anticipated time of maturation. So what is the rat and mice and rabbit temperature requirement? These are the temperature requirements: 22 degrees plus minus 3 degrees, 80 degrees plus minus 3 degrees. These are the relative humidity requirements: 12-hour dark and light cycle, conventional lab diet, and water should be ad libitum. Healthy young adult nulliparous females could be used. Acclimation can do as per the study plan 5 days or 7 days. Uniform age and weight. The females from the male of the same species and strains to be used. The number of animals and dosing. As per OECD, it is required 20 pregnant females per group. As per ICH, 16 females per group. The dosing exposure is from implantation to day prior to scheduled cesarean section. That is 1 day before the day of maturation. That may be day 20 or 21 in rats and day 29, 30 in rabbits. ICH throughout the period of organogenesis, that is 5th to 15 day in rat and 6 to 18 day in rabbit. So mainly 3 dose levels with one control to be used. High dose produce mortality, toxicity, but not death, severe suffering. Mid dose minimal observable toxic effect should be observed. Low dose, that is no effect on maternal or developmental toxicity. Limit dose is 1000 mg per kg body weight per day as oral route is concerned. So dose volume should not be increased 1 ml per kg body weight. For aqueous solution, not exceeded 2 ml per 100 gram of body weight, and vehicle like corn oil not exceeded 0.4 ml per 100 gram of oil. What are the endpoints of this study? This is clinical science, maternal food intake, body weight gain, necropsy, so organ micropathology, uterus weight, implantation sites, number of trapezoidum, early and late resorption counts. Regarding fetal evaluation, fetal sex, fetal body weight, external visceral skeletal abnormalities, anogenital distance, CR length, some hormones, that is T4, T3, TSH, now endocrine disruptor guideline is revised. Fetal sex, body weight, external visceral and skeletal abnormalities, and NOEL or NOEL for maternal and developmental toxicity. What are the terms used in the listing? What is the variation? What is malformation? The permanent change that alters the survival or development of the procedure will be called as malformation. A change that may not be permanent but does not affect the survival, that is we called as variation. Teratology means the study of malformations from Greek word, is called as monster, teras. Now we are going to show some photographs of external, visceral and skeletal malformation. So this is cleft lip. Cleft lip in rat fetus is a condition that can be studied using animal models to understand the human craniofacial development and birth defects. Researchers have used rat models to investigate the fetal wound healing and scar formation in the cleft lip. This is the normal appearance of the fetus in the cleft lip. This is exencephaly. Exencephaly means the brain out of their cranial cavity. Congenital disorder characterized by the exposure of the brain to large defects in the skull, also known as cranium bifida. This condition occurs when the neural tube fails to close properly during embryonic development. These conjoined twins rarely observed in malformed fetus. In visceral malformation, these are the classical called as tetralogy of Fallot, that is a congenital heart defects that consist of 4 characteristics of heart defect. This is a normal heart, shows in the left side. This right atrium. So ventricular septal defects. This That is the hole in the wall between the two ventricles. So pure and impure blood mixed together. Pulmonary stenosis, narrowing of the pulmonary wall or main pulmonary artery. The right ventricular hypertrophy. This is thickened right ventricular hypertrophy. Thickening of the muscles in the right ventricle and overriding aorta. The aorta is positioned over the ventroceptal defect, allowing oxygen poor blood to flow into the aorta. What are the complications? That is long-term complications. Potential complications includes arrhythmias, heart failure, and pulmonary regurgitation. This is the variation. It is supernumerary lobes in the liver. Extra lobe, if we call it. Diaphragmatic hernia. These are the various visceral malformations, that is dilation in the lateral ventricle of the brain, dilation of the third ventricle of the brain, that is we call as hydronephrosis, then cleft palate, etc. Now these are the some example of the skeletal malformation. This is the control image of the skull, ex-occipital control image. Here we can observe that ex-occipital bone is with the atlas. Bent femur. This is normal image of the bent femur. Tibia fibula is bent here. You can observe clearly. These are the control image of the ribs. Ribs are branched here. One thoracic arch absent. Corresponding thoracic arches are fused. The additional finding is short supernumerary rib here. From here. Thank you.